pregnancy that occurs outside the womb. So it's not a viable pregnancy. It's not a pregnancy that's going to last. And it can actually become a life-threatening emergency requiring very serious prevent PID. Well, prevention is better than cure, which is the case with all medical conditions, as you know. So really, the best way to do is very regular STI screens. And if you're having regular partners where you're entering or leaving a relationship, we'd say you should test every 3 months or at the beginning or end of a relationship. That's one way of preventing PID. And of course, obviously, the easiest way to prevent PID is by practicing safe sex and always using condoms. Thank you.
Pros and cons. Properly discharged from the vagina, the uterus is usually enlarged and sensitive to pressure as they design the ovaries and fallopian tubes and nexus. Languages will and are precisely sensitive if the doctor toddlers or movement the cervix during pelvic examination. 6 women in feeling much pain.
Pelvic inflammatory disease, also known as PID, is the topic for this video. And pelvic inflammatory disease is basically an infection of the female genital tract, and it can affect a large number of parts of that genital tract, and those include the cervix, uterus, fallopian tubes, and also it can also infect the ovaries. And this is a diagram that sort of shows it all. So here you have the cervix that's pointed by that little arrow, and then the uterus is of course a little further up, and then on the sides you have these fallopian tubes. On both sides you have one, and then of course these are the ovaries right here. And the infection can infect any part of this female genital tract. What is the cause? What is the organism? Well, there's two of the most common. There's quite a few, but the two most common are Neisseria, gonorrhea, and the other one is chlamydia. Chlamydia trachomatis. And these two are by far the two most common. There's other organisms involved that can be involved, but these are by far the two most common. And one thing that's in common with both of these is that their mode of transmission is sexual. So it's really an STD. It's sexually transmitted, and most commonly occurs in women less than 35 years of age. So what are some of the symptoms? The symptoms of PID are actually pretty classic. There's sort of a triad. There's lower abdominal pain. There's something called adnexal tenderness, and what that means is pain in the sides of the abdomen near the area where the fallopian tubes are. It can be unilateral or bilateral. And then something called cervical motion tenderness. This is most likely elicited on physical exam. And what that really means is that during physical exam, when you insert a finger and actually move the cervix, that can cause, and chlamydia, which are the two most common, Neisseria and chlamydia. And another thing that's done in the workup of PID is a pregnancy test, beta-HCG, because ectopic pregnancy that we just talked a little bit about, its symptoms are very similar to that of PID. So when you're trying to diagnose PID, you also try to diagnose ectopic pregnancy, and that can be done with a beta-HCG. All right, so then now we get into the treatment. The treatment of PID actually most commonly is oral, outpatient, meaning you give the outpatient antibiotics. But sometimes the patient will need to be hospitalized and given IV antibiotics. So I'll talk a little bit about why. Well, the oral antibiotic regimen is very famous. Ceftriaxone, well, I said oral, but ceftriaxone is given as a shot, but outpatient. It can be done in a clinic. And then doxycycline. This is very, very famous, very common. And you, with or without metronidazole, sometimes metronidazole is given to cover other organisms like trichomonas that can be causative in this case. Inpatient IV treatment is done if you feel that the patient will not have compliance or if the patient is very severe in their symptomatology, and that can be decided by a physician based on the presentation. And there's several ways. There's one way is giving a cephalosporin like cefoxitin plus doxycycline, and then another way is sometimes people are allergic to penicillin, so you give clindamycin and gentamicin. So there's a couple ways of treating it. And then finally, the last thing I'd like to mention before I get into some video.
Used application in the medicine. It as many sexually container, while gonorrhea or children have sex with many different people. He was that sexually transmitted infection. It has recently had PhD.
This is Dr. Carlo Oger for edexitvideo.com. This video is about pelvic inflammatory disease, PID for short. PID affects more than 1 million women in the United States per year. Nearly 250,000 women are hospitalized annually because of PID. Sexually active adolescent females and women younger than 25 years of age are at greater risk. PID is most frequently caused by bacteria that are transmitted through sexual contact and other bodily secretions. Bacteria that cause gonorrhea and chlamydia cause more than half of the cases. Many studies suggest that a number of patients with PID and other sexually transmitted diseases are often infected with 2 or more organisms, and commonly these are chlamydia and gonorrhea. Other organisms can also cause PID but are much less common. Symptoms for PID include abdominal pain, pelvic pain, back pain, abnormal uterine bleeding, vaginal discharge that is unusual or heavy, painful intercourse or dyspareunia. PID symptoms may be worse at the end of the menstrual period and during the first several days following the period. Tests to be done. A urine or serum pregnancy test if the female is of childbearing age. A urinalysis to check for bladder and kidney infection. A complete blood count, although fewer than half of women with acute PID will have an elevated white count, indicating infection. Cervical cultures for chlamydia and gonorrhea, and other sexually transmitted diseases. A pelvic ultrasound, although not routinely done, can be an important tool in diagnosis complications such as tubo-ovarian abscess, ovarian torsion, ovarian cysts, and ectopic pregnancy. This picture demonstrates some of the side effects anatomically of PID. It shows adhesions formation, swelling of the fallopian tube, as well as abdominal pain, fever, chills, pain in the pelvic exam. You can see an accumulation of pus or bacteria next to the fallopian tube. This is a tubo-ovarian abscess. PID and tubo-ovarian abscess. An abscess is a localized infection. An ultrasound is done if you're suspecting this diagnosis. This type of disease is seen frequently in PID. A tube ovarian abscess is a collection of bacteria, pus, or fluid that occurs next to the fallopian tubes and involves the ovaries. Treatment. In most cases of uncomplicated PID, oral antibiotics at home after initial treatment in the ED is okay. In complicated cases, those with significant signs and symptoms or abnormal blood work or ultrasound, IV antibiotics in the hospital will be necessary. Exploratory surgery. A woman's health specialist or gynecologist can use a laparoscope, a small tube with a camera attached, and make small incisions in or around the navel to view the reproductive organs and evaluate whether inflammation is present. The doctor can also identify an ectopic pregnancy using this technique. Definitive care can then be provided from starting IV antibiotics to removing an ectopic pregnancy. Call your doctor or go to the nearest emergency department if you experience nausea and vomiting and you are unable to tolerate your medications, if you have fever or chills, increasing abdominal pain, or if your condition deteriorates rather than get better. If the patient is not admitted to the hospital and does not improve in 72 hours of starting treatment, then the patient must be reevaluated. Do not have sexual intercourse until your treatment is completed and your symptoms have gone away, at least 7 days. Long-term complications. Tubal damage and scarring can result in infertility. Ectopic pregnancy rates are 12 to 15% higher in women who have had PID. Untreated PID also puts you at risk of tubal ovarian abscess. Females diagnosed with PID are at increased risk of getting PID again. Also, chronic pain can be a complication. For other videos like this, please visit edexitvideo.com. But remember, these are for
Conclusion. What is complex PID is important to be dyslexic with scanning pattern to looking out for possible sonographic signs of infiltration. What take currently of zinc and spontan and take ultrasound. An early diagnostic of PID may be made at a complication reduced for the patient.
I was diagnosed with PID.
I was diagnosed with PID. I was diagnosed with PID when the doctor first said to me,
"You have pelvic inflammatory disease."
I was really upset, especially when she told me that most cases of PID were caused by sexually transmitted infection. At that time, me and my partner had been together for over a year. For a month. So I was really concerned about going to him and talking about it
because I was afraid that he would say,
"You burned me."
Or tell his boys that I was a
dirty girl, man.
But my doctor broke it down for me. First of all, she let me know that I was not alone, not to feel bad about myself, and that she had my back. She said,
"PID is a common medical problem. It's my job to take care of you as my patient and to make sure that you have all the information that you need to take care of yourself. About 1 million women in the United States have PID every year. Some of those patients feel bad about themselves when they get it, but you cannot let that stop you from taking care of yourself."